Hello again, everyone. Heather Holmes here with KTV Fox 2 News in the San Francisco Bay Area. And once again, I'm joined by Rashid Chotani, a doctor who is looking into COVID 19. He's also an infectious disease specialist. Doctor, thank you so much for being here.
Thank you, Heather, for having me on the show. And it's always a pleasure to be with you and to talk about something that I'm extremely interested in, obviously, COVID 19.
Yeah,
Uh,
let's talk a little bit because this week we did, in fact, mark a very grim milestone of 100,000 deaths here in the U.S. Your reaction, first of all, to that?
well, what can I say? It's a terrible number to reach in terms of the people that have been affected by that. I mean, we have 100,000 Americans, right now, about 104,000 Americans that have lost their life to COVID 19. And if you think about that, how many family members, how many brothers, sisters, wives, husbands, etc., had to deal with that? I mean, this is a calamity this is a calamity yes, for everybody that goes through that. So when I talk about numbers, when I say that 100,000 people died, I say 100,000 Americans died. And you know, that brings us the reality that these are human beings and they have families. It is a terrible thing. I mean, I cannot say, I mean, my heart goes out to all of the people that have died and all the families that have suffered. And I wish there was a way that we all, as a community, and I in particular, could help them in some capacity. But right now, in the absence of a vaccine, which is a prophylactic, or a cure, that is a drug, there's very little that can be done except the common sense measures that we've all talked about.
Yeah, and I think that that is probably what is most sobering for all of us is knowing that what we're doing is helping, but as you mentioned, it's not a cure. Here in the Bay Area, several counties have reopened, but others, including San Francisco, are still going about this in a very slow approach. In fact, the mayor here in San Francisco announcing yesterday that the stay-at-home order will go on indefinitely. Sort of your thoughts on that?
So you've got about six counties that, where the numbers after the Memorial Day weekend have risen in terms of cases. In terms of deaths, the numbers have not really skyrocketed. But in terms of hospitalizations across the state, in most counties, the number of hospitalization has not gone down. So you've got to take a look at all these parameters in order to make a decision as how you're going to move forward. Now, yes, we cannot have shelter at home indefinitely. There has to be a plan. And I am absolutely sure that the mayor is taking a look at things in terms of data and talking to scientists and public health professionals as he has been. And he's making some very calculated decisions because, as you can understand and appreciate, you know, and I commend him for that. To be very honest about it, for being bold, because a lot of people, legislators, are looking at their political survivability at this particular point, and to come out and say that, listen, we have a problem and we've got to deal with this problem, and this is how we're going to deal with it, is commendable. So yes, he is listening to the public health professionals. I was listening to the county executive of Dr. Judy from Santa Clara County,
Mhm.
and she was also saying something similar. And we've got to take a look at what's going on. We've got to have a very slow, calculated approach in terms of opening what we have to start. And it's just going to happen. But we've gone through so many months of this problem right now, and I think that these are the last few weeks that people have to essentially suffer. And if there's a possibility, if there's a way that you can work at a home and not get exposed, I would recommend that we do that. But yes, we have to. But and with all that I've listened to and heard, what the mayor of San Francisco is saying, he is going to make announcements, but he's going to be careful in terms of making those announcements. It's going to be a very slow, steady, opening up of the county.
Yeah. I want to talk about something that was a big concern, which was after the Memorial Day weekend, and we were talking last time about the fear of more cases, and that in fact is what we saw here in the Bay Area. Surprise you at all?
No, not at all. I mean, it's not going to, as I said, we don't have a prophylactic, we don't have a cure. The reason that we did all what we've done and what we are continuously doing, and this is what I've been saying and advising public health professionals and county executives, mayors, etc., that what we did was to kind of bring down the numbers in terms of the cases, in terms of kind of slowing down the epidemic. So the numbers have gone down, but what is going to happen when we open up, there is going to be an escalation in the number. The numbers are going to go up. And what we've got to be really cautious of is that every single individual is making sure that they're taking the right common sense precautions, masking, keeping the social distancing, doing the hand sanitization and hand hygiene. These are the critical things. And there's ample research data, and we've talked about it previously, that clearly has shown and demonstrated that if you wear a mask, yes, a regular mask doesn't really protect you from the virus. If you wear any type of a mask, what happens is that you are at a distance from another person. You are not infecting somebody else. Now, if you take into consideration what we've done for decades, right? What we've done is we in the operating room, everybody wears a mask. So why do we wear a mask while we operate? Or why do we wear a mask when we are doing some kind of a procedure as a physician or a surgeon in a given environment? The reason for that is not to essentially protect yourself, because we know that those particular masks, the surgical masks that we are wearing, are not really going to protect us from getting the virus if there's some virus, because it's not the right type of personal protective equipment that we have. But what it's going to do is it's going to make sure that if I cough and if I've got somebody opened up, right, if I sneeze and if I've got somebody opened up over there, I'm not putting some viruses or bacteria, whatever it is, in that particular body. So we've known that for a very long time, that it does protect somebody else if you wear a mask. Now, we've talked about this over and over, and again, I want to make sure that everybody that's listening is paying attention to one very important fact. And you have to question yourself, and don't take my word for it. When you wear a mask, in all honesty, people don't really come close to you. They keep the distance, the 6 feet distance. We know now that 6 feet, by the way, is not even good enough. But if you wear a mask, that's a good distance, in my opinion. But if you don't wear a mask because you're very comfortable, your friends are going to come much closer to you. And while you talk, essentially, while I'm talking right now, I'm expelling a lot of particles from my mouth that are going in the environment. And if I have COVID-19 or any other virus, I'm contaminating the entire environment. So we've got to do that. And please just think about it and do it. Believe me, this is perhaps one of the best things that we have to fight against COVID-19.
Okay, I want to talk about something, and that is as various counties look to reopen. We see restaurants, perhaps they're going to have dining outdoors. Pickup is an option, but it seems as though when it comes to, let's say, hair salons and barbershops, there is still a lot of concern there. Explain the concerns surrounding those types of businesses.
So hair salons and barbershops, I mean, to be honest about it, I really want to go to go get a haircut. And my hair is getting long, and I've not had a haircut for a long time, but I'm using mousse, by the way, so that's why it's staying in place. But the reason that we have to be careful is because you come into very close proximity to an individual where you're cutting their hair, or a person who's getting a haircut, or a person who's doing the nail saloning and getting the nails done and all that. So there's the distance between two people is much closer. Now, if they're wearing a mask, which is a regular mask, they definitely are not 6 feet apart. If they're wearing an N95 mask, yes, both of them, then yes, it might be safe. It is probably safe at that point. But that is very difficult. And I understand the dilemma. I mean, the dilemma is not on the individuals who need a haircut. The dilemma is for the people who operate those shops and make a living, being working in a beauty salon or a hairdresser shop or something like that, or a barber shop. That is a problem for them because they've lost their livelihood. My favorite place in Great Falls, where I live, for the last 10 years, we've gone to the same hair country. Believe it or not, all the kids, myself, my wife, everybody goes to the same place. That business shut down.
Mm.
And I don't know what happened to all those people, and it is terrible. And a lot of businesses are going to shut down. We've got to come up with ways that are protective in a way that we can start operating those businesses, because this economy is tanking. In all honesty, we have incredible unemployment rate. We've never seen anything like this. And to recover back from where we are today, God knows how long or how many years it's going to take. And the longer we prolong this, it's going to take longer for us to get back. So precautions, taking care of things, making sure that you're protecting yourself and the person that you're talking to or you're with, and then coming up with these physical barriers that can potentially protect you is the way to move forward in this environment.
But before we wrap up, I just have one more question for you, and that is, as we continue to track COVID-19, we're obviously going to see more cases. Explain why more cases doesn't necessarily mean, or what does the fact that we're going to see more cases, what does it mean in our fight against this pandemic?
So we will see more cases. There are multiple scenarios that you can think about. Right now, we have still not flattened or gone all the way down in terms of the number of cases for this disease. Now, if you look at New York by itself, and New York City and the surrounding area, you will see a curve where everything has gone down. The numbers have gone really, really down compared to what they used to be. When you look at other states, other counties, other jurisdictions, you don't see that type of a curve. We need to see where the cases have really, really gone down. And once we are there, then we will have to continue dealing with this disease. So the disease, the virus itself, has not gone anywhere. The virus is still with us, and it's going to stay with us, unfortunately, unless and until we have a cure or a prophylactic. We are going to be very uncomfortable with this situation now. Think about what might happen when the virus comes back as a second wave during the flu season this year in the fall. You already have a huge problem with influenza, and then on top of that, you have a COVID-19 and cases showing up. Our hospitals are going to be overwhelmed. We won't have a vaccine or therapeutic by that time. So again, as much as I can say, and this is what I keep saying every single day, I don't know how many hours a day, use common sense precautions. You can still do what you want to do, but make sure you're wearing a mask or whatever type of mask you can get. If you don't have one, make one. Please wear a mask. Make sure that you're keeping the social distancing. We're not gonna die if we don't hug people right now. Let's not do that. Let's not shake hands for a little while. Let's smile and tell people we love you. You can say that. You don't have to actually physically do it. And then make sure that you're keeping your hands clean and doing the hand hygiene. And that's how we've got to move forward.
Okay. Dr. Chotani, always a pleasure. Thank you so much. You have a nice weekend.